Welcome to our debate on the ethics of treatment approaches. My name is Casey. I will be the introducer for the group. We also have Maida, who will be doing some summarizing as well as going over Compliance Code 4. We have Emmeline, who is our illustrator. We have Brandon, who is our researcher and will be going over Compliance Code 1. And we also have Emily, who will be fielding questions throughout the debate and also going over Compliance Code 2. Okay, so ethics of treatment approaches. So what does that mean? We will be examining some of the treatments used in applied behavior analysis and whether or not they are ethically based upon research and history. Dating back to the beginnings of ABA, there have been a wide range of ideas regarding ABA treatments, some of which have unfortunately left a lasting scar upon the name of ABA. However, we intend to prove that with the coming of the BACB compliance codes, the core ethical principles, as well as the use of evidence-based treatments, that applied behavior analysis is in fact an ethically sound science and uses only the most up-to-date and appropriate treatments available. Conversely, it will be mentioned that there have been several accounts of clients being treated unethically and even therapists behaving in a manner unbecoming of an analyst. However, using the compliance codes as well as other findings, we will attempt to prove how even with these blemishes, ABA treatments as a whole are still ethically acceptable and based on a science that works. Maida will now be going over a summary of what our debate will also involve.
All right, so ABA hasn't always been ethical, and many regrettable experiences have happened in the past that make people question how ethical applied behavior analysis is. The good news is that this is not the case anymore. Behavior analysts follow a set of guidelines in order to make ABA ethical. ABA can also prove itself to be ethical when choosing appropriate treatments. Behavior analysts implement well-established intervention that are evidence-based and has been tested to be effective several times. Treatment fidelity is also taken into consideration when conducting treatment. As mentioned before, many years ago, behavior analysts focused on behavior modification without using effective treatment, and often turning to treatment procedures that were cruel and did more harm than good. Fortunately, that started to change when court cases started to address the right to enjoy basic privileges and refrain from the use of aversive treatments. Another factor that should be considered when deciding if ABA is ethical or not is who can deliver ABA treatment. Even though treatment can be conducted by people with little experience, training and supervision from a behavior analyst is required. Different practices are maintained by the protocol created by the Behavior Analyst Certification Board, which is what keeps professionals in this field practicing ethical procedures. And this is a summary of what we will be talking about today.
All right, so to begin, our first point will center around BACB Compliance Code 1, which focuses on the responsible conduct of a behavior analyst. So Brandon will be going over that.
Thank you, Casey. So, as Casey mentioned, Compliance Code 1.0 is the responsible conduct of a behavior analyst. This states, in a nutshell, that the behavior analyst will maintain the high standards of professional behavior of the professional organization they are a part of, and this includes being honest, having integrity, being reliable, maintaining confidentiality, and maintaining trustworthiness. These are all important in the field of applied behavior analysis. The first specific compliance code that we will hit on is Compliance Code 1.2, which is competence. So Compliance Code 1.2 Part A is behavior analysts provide services, they teach and conduct research only within the boundaries of their competence based on their education, their training, their supervised experience, or appropriate professional experience. Compliance Code 1.2 Part B is behavior analysts provide services, teach, or conduct research in new areas or involving new techniques only after first undertaking appropriate study, training, supervision, and or consultation with people who are competent in these areas or techniques. Are there any questions on Compliance Code 1.2?
I do have a question, actually. So how would a behavior analyst respond when he or she realizes that services or treatments being provided to a current client are no longer within their area of expertise?
That's an excellent question, because I think this happens a lot in the field, and a lot of BCBAs have to deal with this. So how I would approach that question is, if a behavior analyst goes into a situation where they don't have enough personal background and experience, they should seek out training. Any available training that is in their area, or if they have any people they know who have background in this, receive training from them so they have an idea. Or if they don't feel competent enough with finding research, they can refer somebody. And after they refer someone, they can take the client or consult with them. Great question.
I actually have a hypothetical situation that might be able to illustrate this point a little bit further to answer your question, Emily. Let's say a client is referred to a behavior analyst for a feeding intervention. The individual, let's say he's 17 and he is diagnosed with Down syndrome. The behavior analyst has training and experience with feeding intervention and dietary behavior change. However, he does not have experience working with this adolescent age and has little training when treating clients with a diagnosis of Down syndrome. So as Brandon mentioned, this behavior analyst should seek out training or can refer to a different provider or colleague that does have more experience in this scope of practice.
Okay, excellent example. So we will move on now to Compliance Code 1.4, which is integrity, which is a very important compliance code. Compliance Code 1.4 Part A is behavior analysts are truthful and honest. Behavior analysts follow through on obligations and professional commitments with high quality work and refrain from making professional commitments they can't keep. Compliance Code 1.4 Part B is the behavior analyst's behavior conforms to the legal and moral codes of the social and professional community of which the behavior analyst is a member. Compliance Code 1.4 Part C is the activity of a behavior analyst falls under these guidelines only if the activity is part of his or her work-related functions or behavior analytic in nature. Compliance Code 1.4 Part D is if behavior analysts behavior analysts' ethical responsibilities conflict with law, behavior analysts make known their commitment to these guidelines and take steps to resolve the conflict in a responsible manner in accordance with the law. Now, I have some research that is against this compliance code, showing that integrity is put in jeopardy in applied behavior analysis. And this is a paper written by Wheeler, Baggett, and Company from 2006. Their problem with integrity is in many interventions between the late 1980s and early 2000s is brought into question. This leads the author to come to the conclusion that a relative lack of attention to treatment integrity is both surprising and worrisome. Now, many studies in the late 80s and early 2000s, there was just a problem with integrity. So if there's a problem with integrity, that puts all of the interventions at risk in applied behavior analysis, because if one has an integrity issue, how does a client know that another one doesn't have integrity issues, even though they say there is no issues? One problem, you start chipping at one, the whole thing crumbles. So this was a very worrisome problem with applied behavior analysis. Is there any questions regarding this research?
Yeah, so you said that this research was completed in the late 80s to the early 2000s. That seems like kind of a long time ago. So is this data even still relevant today?
My opinion, not as much, because that was 15 to 20 years ago, 25 years ago in some cases. So there's been a lot of progress in applied behavior analysis, and now there's more scientific method used in interventions, and integrity isn't as much of an issue as it was back then. Also, I have more research from Bout and Hume in a 2010 paper, which states that in order for an intervention to be legitimately considered as an applied behavior analysis intervention, it must have frequent assessment and measurements of its efficacy, as well as implemented with fidelity. So this was in 2010. That is 10 to 25 years before my last example. So that shows that now there's more frequent assessments and measurements to make sure that there is integrity in interventions these days. Does that answer your question?
Yeah, definitely. I actually do have another question, though. So how important would you say that honesty is between the behavior analyst and parents, caregivers, or the client, him or herself? And then sort of as a follow-up to that question, how would the behavior analyst decide how honest he or she should be?
So that's a great question. I mean, there has to be a limit to everything, I guess. But I feel like honesty may be the most important thing to the client, because if you can't have honesty between a behavior analyst and the parent or client, it's really hard for the parent and client to trust the behavior analyst. So the behavior analyst may provide a very effective treatment plan, but if there isn't trust involved, they just won't use it because they don't trust the behavior analyst. So to answer your question, I think forming trust is very important to being a behavior analyst. And I don't really think there is a limit. I think that every behavior analyst should strive to just have 100% honesty with their client or the client's parent, even if the honesty, what they're telling them, isn't very good. And they may get mad at the behavior analyst, but it shows an honest approach, and it keeps that honest bond with the behavior analyst, which is important. Does that answer your question?
Yeah, definitely.
Okay. So if there's no further questions, we will follow up on Compliance Code 1.6, which is dual relationships and conflicts of interest. Compliance Code 1.6 Part A is, in many communities and situations, it may not be feasible or reasonable for behavior analysts to avoid social or non-professional contacts with persons such as clients, students, supervisees, or research participants. Behavior analysts must always be sensitive to the potential harmful effects of other contacts on their work and those people whom they deal with. Compliance Code 1.6 Part B is behavior analyst refrains from entering into a promising promising a personal, scientific, professional, financial, or other relationship with any such person if it appears likely that such relationship reasonably might impair the behavior analyst's objectivity or otherwise interfere with the behavior analyst's ability to effectively perform his or her functions as a behavior analyst, or might harm or exploit the other party. Compliance Code 1.6 Part C is if a behavior analyst finds that due to unforeseen factors, a potentially harmful multiple relationship has arisen, behavior analyst attempts to resolve it with due regard for the best interest of the affected person and maximal compliance with these guidelines. Is there any questions regarding Compliance Code 1.6?
No, I think that you have answered a great deal of our questions so far.
Thank you.
So if that wraps up Compliance Code 1, yes?
It does. It does wrap up Compliance Code.
We can go ahead and move on then to Compliance Code 2, which is the analyst's responsibility to clients. And Emily, you can go ahead and take it away.
Okay. Like you mentioned, Compliance Code 2 goes over the responsibility that a behavior analyst has to their clients. And I'm just going to go over a couple of sections of it that are important for our topic. The first one is 2.09, which is treatment, intervention, and efficacy. Part A states that behavior analysts must provide all relevant information about treatments to the client. Effective treatments are those which are scientifically supported and produce both long and short-term behavior change based on the client's individual needs. Part B states that behavior analysts have to decide what amount of treatment is necessary for a particular behavior change program to be effective and to meet the goals that would be set within the program. The behavior analyst must then provide the supports that would be needed for the client to receive said treatment or intervention. Part C says that when there is more than one effective treatment that could be appropriate for the client, other factors need to be considered as well. These factors could include the cost, risks and side effects of the treatment, who will implement the treatment in their ability level, and then the client's preference for one treatment over another. Part D kind of goes along with Part C, but it states that the behavior analyst must be prepared to answer any questions that the client might have regarding the aforementioned factors that I just listed. Anything to add to 2.09?
I do have an illustration to help prove, that treatment efficacy is something that we should all practice in the profession. For an example, a elementary school teacher has asked for a behavior analyst to write up a behavior change plan for non-compliant behaviors that the teacher is seeing from one of her students. The teacher meets with the behavior analyst one-on-one without the client present, and the teacher briefly explains the behaviors that she has seen. She then requests recommendations at that meeting from the behavior analyst. This would not be ethical for the behavior analyst to provide recommendations and a plan at that point. As Emily stated, the behavior analyst has to provide scientifically supported treatment using assessments and other scientifically based ways to determine the function and how the behavior change plan should be appropriately designed for the client.
If there isn't anything further to add, the next section would be 2.10, which deals with documenting professional work in research. Part A states that documentation must be kept by a behavior analyst in a professional and easily understandable fashion. This is necessary so that the client can receive appropriate treatments, either at a later date in the future or from other professionals at the same time. Documentation must also be in compliance with the guidelines set forth by the behavior analyst's workplace and the law by which all citizens in the area would abide. Part B of that one's kind of restates a little bit of Part A about the law and the organization's guidelines. It also states that a behavior analyst is responsible for creating documentation so that detailed information can be collected and maintained throughout the treatment. Does anybody have any follow-up for that one? No? Okay. Moving on to 2.11 then. That involves records in data. Part A states that in all ways that a behavior analyst deals with records and data, so whether that's creating, storing, disposing, etc., of documents, they must comply with requirements of the BACB's Professional and Ethical Compliance Code for Behavior Analysts. That's the document that we're summarizing right now. And the laws in the area in which the behavior analyst practices. Part B states that unless the laws in place in the behavior analyst area say differently, all records and data must be stored for at least 7 years. Any follow-up to that one?
I do, actually. I have some research that that shows a positive light on this record and data keeping. So a paper written by Jay Cooper entitled Applied Behavior Analysis, he discusses 4 main assessment techniques that ensure ethical collection of information. These include interviews, checklists, standardized testing, and direct observation. These ensure the ethical collection of information, and it's a very responsible way of data and record keeping. Just wanted to point that out.
Great. Emily, did you have anything else to add on to Compliance Code 2?
I do not. That is all of it.
Awesome. So we will go ahead and move on to Compliance Code 4, which focuses on the behavior change program, and Maida will go ahead and take that one.
Thanks, Casey. So we'll be talking about Compliance Code 4.02, 4.08, and 4.10. So 4.02 is involving clients in planning and consent. Behavior analysts should involve parents and the direct client in the planning process. Behavior analysts should obtain consent for behavior change programs as well. Does anyone have any questions regarding 4.02 or anything to add? Nope. Okay, perfect. So let's go to 4.08, which is considerations regarding punishment procedures. And there are 4 parts to this. Part A is behavior analysts are supposed to choose and recommend reinforcement instead of punishment procedures. Part B is in the case where punishment procedures are necessary, behavior analysts will take additional steps in order to make sure that appropriate behavior is being reinforced. Part C states that before considering punishment procedures, behavior analysts ensure that reinforcement-based procedures have already taken place. And this is different if behavior is dangerous and needs immediate use of punishment procedures. Last part is Part D, which states that behavior analysts have to provide additional training to those that will be implementing aversive procedures. and aversive procedures are to be discontinued when no longer necessary. So I believe that Brendan has some research to add regarding to 4.08.
I do. There's a potential, a con problem with 4.08, and this is discussed in a 2011 paper written by Bailey and Birch. It discusses the Sunland Miami scandal, which occurred in the 70s, 1970s to be precise. There were aversive procedures which were being applied to individuals with autism, which included forced public masturbation, forced public homosexual acts, physical abuse with a wooden paddle, and other worse aversive procedures were being conducted as well. This sounds like a lot of punishment.
I have a question actually regarding your research. Because of those aversive procedures that were used in the past, specifically in the 70s, as you mentioned, how could somebody today be sure that punishment procedures won't be harmful to an individual?
I mean, that's a great question. I think any parent who has a child with autism should be worried about punishment procedures, especially if they've read about the Sunland Miami scandal, because if I had a child with autism, I wouldn't want them to have to deal with these kind of punishments. But again, this is in the 70s, 1970s. That is about 45 years ago now. That's a long time. That's half a century, I think. Yeah, almost. So today, and this is in a paper written by Butte and Hume in 2010. They state that the purpose of applied behavior analysis these days is to find a correlation between different treatments and their outcomes. And with these correlations, they provide a positive reinforcement instead of punishment, because positive reinforcement doesn't have the bad outcomes that punishment has. And punishment is only used in the worst case scenarios where positive reinforcement will not get the job done quickly enough, such as self-injurious behavior, and punishment is needed. Does that answer your question?
Yeah, I actually do have another question regarding this compliance code, though. Does the behavior analyst have to directly plan and oversee all possible reinforcement-based behavior change plans before designing punishment procedures, or can data taken by other professionals be used to rule out reinforcement strategies?
Does anyone know how to answer this question? Okay, then I will go for it. Yes, behavior analysts definitely have to be in charge of all procedures and data taking in order to make any further decisions. So if a behavior analyst does want to, or if, let's say, a teacher does want to use a punishment procedure, the behavior analyst does have to take data and do several assessments in order to make sure that reinforcement has been used already. Does that answer your question?
Yeah, definitely.
All right, do we have any other questions? Nope. Okay, so then we will move on to 4.10, which is avoiding harmful reinforcers. And this states that behavior analysts avoid using items as reinforcers that might harm the client's health. Does anyone have anything to add to this compliance code?
Yeah, I have a question actually about it. I think the area of ethics can lead to some kind of situational questions, so I guess I have one of those. So I have heard that some therapists prefer to use edibles or specifically sweets for reinforcement. So how would a behavior analyst address or respond to parents' concerns about that?
I think Emmeline has an example that would answer your question.
I do, especially since you posed your question, with a hypothetical circumstance. I'll answer it with one. Let's say a behavior analyst is targeting an aggressive behavior in a 5-year-old boy, and he is highly motivated by sweets, like you said. However, this specific child has a dairy allergy, and the sweet of his choice is ice cream. The behavior analyst is aware of the allergy, so should the behavior analyst proceed and use create behavior change? The behavior analyst would be unethically providing treatment if using this motivator. The behavior analyst should, however, conduct to determine other options that are as equally reinforcing to the child
So unfortunately on my end, the video broke up a little bit, Emmeline. Would you mind summarizing what you stated about the finding other reinforcement items, basically?
Yes. So instead of a reinforcer or something that a parent may not approve of for a reinforcer, the behavior analyst in that situation should conduct a reinforcer assessment to determine other options of reinforcement that provide similar outcomes for behavior change.
Awesome.
Does that help?
Yeah, definitely. Yeah, that makes sense to me.
Perfect. Do we have anything else to add or any other questions regarding Compliance Code 4.10?
Nope.
Nope. Okay, then I guess we covered Compliance Code 4.0.
Okay. So were there any other questions regarding what we have discussed so far that maybe were not brought up during the specific discussions of Compliance Codes 1, 2, and 4?
I do have just a couple of questions. The first one would be, how does a behavior analyst handle discussing a client in regards to who he or she is able to talk to and how much information should be shared?
That question can be answered by looking at the compliance code of confidentiality. A behavior analyst has an obligation to respect a client's confidentiality, and a behavior analyst cannot talk to a third party about their client's treatment or personal information unless the client or the client's guardian has given written consent for them to do so. So even if, for example, even if a person, a teacher, or maybe a babysitter of some kind, a different person that provides care for a client, asks the behavior analyst for information regarding client's behavior, the behavior analyst should not conduct any sort of further contact with that person unless the guardian or the client themselves has given written consent that the behavior analyst can have conversation with them.
Perfect. Any other questions that we can go over?
I do have just one more. So I guess this is just open to whoever would like to answer it. But do you think that punishment procedures can effectively be used in perhaps like a school setting? Anybody want to take that one?
That's a great question. I think that if necessary, then and a behavior and with the supervision of a behavior analyst, then punishment procedures could be used, depending on the scenario where the child, it all depends on the situation and if reinforcement has already been used and it wasn't successful. Does anyone have anything to add?
No, just I guess to continue on, just like you said, Maeda, as long as there is direct supervision involved by an analyst, as long as there has been proper training given for the punishment procedure, a punishment procedure should be able to be used in a school setting, with the exception that it does not disturb or go against maybe disrupting the class is what I was trying to say. And of course, as long as consent has been given by the parents and possibly, depending on the age of the client and the competency level, client as well. So.
Thanks for adding that, Casey.
All right, I believe that there is one more question, though, that had to do with a table that Emmeline has regarding the Genera Read and Lovett survey table.
Yeah, let me pull that up for you, and you can talk about that a little bit if you would like, expand on that.
Sure. I know that it has been brought up that one of the myths of applied behavior analysis is that therapists actually prefer to use aversive techniques or punishment procedures, which is why I wanted to bring up this table. According to the Genera Read and Lovett survey from 2008, it was actually established through the survey, which was conducted, that the majority of therapists, at least in this survey, prefer non-aversive techniques. So even though aversive techniques, punishment procedures, can sometimes have a faster outcome, a faster treatment approach, it does not necessarily mean that therapists want to use them. According to the chart, it actually says that non-aversive techniques, positive reinforcement procedures definitely are the preferred method of treatment when it comes to implementing any sort of treatments for problem behaviors that may arise with some of the clients that we work with.
Casey, I actually have a follow-up question on the table.
Sure.
So do you think that this is because the people involved in this study, they think that long-term positive reinforcement procedures work better than punishment, or is it only for ethical reasons that they prefer not to use punishment? Just asking your opinion on this.
No, of course, Fuller. It actually kind of goes into that a little bit on the table. It says part of the table is on efficacy or the efficiency of the treatment. And it says in the table, according to the research, that positive reinforcement is more effective than punishment at changing behavior. And so therapists that were in the survey definitely agreed that positive reinforcement just had a better outcome than punishments regarding certain behaviors. Now, unfortunately, I don't know what behaviors they were thinking about or what they were asked about, but it does seem to be that the preference is positive reinforcement, which goes right along with our compliance codes anyways, that a positive reinforcement procedure should be used prior to implementing any sort of punishment anyways. However, there is definitely an ethical component. then it says it should be reserved for behaviors that pose a danger to the individual or others. And that was a very strong part of the table in itself.
Okay.
So, so if there isn't anything else from anyone, no? Okay, good. So let me see. I do want to go ahead and end our debate then just by saying that clearly ABA has evolved greatly over the past 50 years or since its beginnings. Unfortunately, there are still studies or still stories that do affect how it's thought of today. However, with all the changes that have taken place, it has definitely allowed for it to become a well-respected and proven science. Through the core ethical principles, through the compliance codes that we have discussed, I do believe that ABA has been given the moral backing needed to be used today. Through the accounts that we've discussed, through evidence-based studies, and using the treatments that we use, it is definitely ethically justified as a best practice for behavioral therapy. And I will end also on using an article from Rogers and Vismera, Evidence-Based Comprehensive Treatments for Early Autism. And that says that evidence suggests that early intervention programs are indeed beneficial for children with autism, often improving developmental functioning and decreasing maladaptive behaviors and symptom severity at the level of group analysis. So I thank everyone for tuning into our debate, and that's it.
Perfect. Thanks, everyone.
Thank you.
Thanks.